Root canal therapy essentially is cleaning the inside of the tooth right down to the very bottom of the roots of the tooth and taking out any tissue or bacteria that's alive in there and sealing it back up again so that no bacteria can get back in. Root canal therapy is actually quite common. Teeth that have a hard life or have lots of fillings over the course of their life are more likely to need root canal in their later years. So as people live longer, they're more likely to need root canal. It's something we do hear quite a lot. Once a tooth needs root canal, you only really have two options, unfortunately. You either go through root canal treatment or you have to extract the tooth. Obviously it's better to keep your own teeth where you can, so we would do root canal. The alternative would be to do an implant where you would take the tooth out and then you'd screw in a titanium post to act as the roots. It's obviously better to keep hold of your own roots and your own tooth where possible, but one of the alternatives would be an implant. And if patients have a root canal that's not successful, or if it does get reinfected, then an implant would likely be the next alternative. We would only do root canal therapy when it was 100% needed. So normally that would have been identified at an earlier appointment, would have taken some x-rays and tested the tooth to make sure that there was no other option for it. And then you'd be given a plan so you knew what was going to be involved with the root canal. And then on the day of the procedure, you would come in the same as you would just for a simple filling, and we would numb you up. Once we've numbed the tooth up, and we put our rubber dam on to keep it nice and clean and dry, the patient wouldn't necessarily know whether they were having a filling or a root canal. Root canal therapy can either be done in a single sitting, or more frequently it's done over 2 visits. So at the end of the first visit, a nice temporary filling would be popped in there to keep it nice and clean. Between visits, patients can have a couple of days discomfort after a first visit. It's not that common and it's not easy to predict, but we put a medication inside the tooth to help alleviate any symptoms that people might have, and then we can give extra painkillers or medications if it's needed. But usually after a day, patients don't even know they've had the root canal. Root canal can be complex just because everybody's different. Anatomy can be different. 2 teeth in the same person can be very different. So you can be unlucky and just have complex anatomy. Or other than that, root canal tends to be more complex. If the root canal has been needed for a long time, if the tooth's heavily infected, generally the longer you leave it before we start, the harder it is to do. So if it does need to be done, generally the sooner it's done, the better. After we've completed the root canal, there's always a really strong restoration placed in the tooth, but ultimately long term, those teeth are going to need a crown, a really strong lab-made filling on the tooth to make sure the tooth can't break again. So a crown is the best procedure that we can do after the root canal to make sure that the tooth lasts as many decades as it possibly can. I actually quite enjoy root canal therapy. A lot of people don't like doing it as dentists, and obviously patients don't really enjoy having it. But I enjoy the sessions themselves. I have like an hour or so. You get some music on, the patient can watch something on the screen on the roof, and it can actually be quite relaxing. It's quite therapeutic to clean the tooth out and get rid of, because root canal pain can be some of the worst pain people have ever experienced in their life. So to take somebody that has that level of discomfort and be able to reverse that and completely take the pain away is really rewarding work to do.